We have had the privilege of serving this senior center for the last 6 or 7 years. My associate Pat Lanny is here every single Thursday afternoon. So a lot of the questions that you have, Pat will hang around afterwards. And if you want to schedule an appointment with him, he's here every Thursday. We're local. I live in Ashburnham. Pat lives in Fitchburg. And we can come to your house as well if you're more comfortable with that. I've had the privilege of being friends with this man, Brian Guanini, who is a field outreach coordinator with Blue Cross Blue Shield of Massachusetts. There is no affiliation between the two of us, but we've been friends for
20, maybe 15?
15 years.
15 years?
Yeah, 15 years.
I worked for a competitor, and I used to come here every...
And we're friends still.
We're friends still. I worked for, not a competitor case, a competitor of Blue Cross. And I came to the senior center every month for 8 years maybe.
Yeah.
So some of you might recognize me with with the other carrier. Laid off during the pandemic, came on to Blue Cross a year ago. I'm here not in a Blue Cross capacity.
Sure. And
I'm not here, we're not affiliated with Integrity, although I'd love to be. They're a great company. Keith runs a great operation, but we're not affiliated at all. In fact, the only reason I'm wearing this shirt is because it's hot outside and it's a dry fit. So I wanted to do that.
Sweat wicking?
Yes, sweat wicking. But again, I'm not affiliated. This is not a Blue Cross presentation. This is more of a presentation that talks about what to do when you approach Medicare eligibility. So I'll do that when you're done.
So
and it's going to be about maybe 35 minutes.
Fantastic.
And if you have questions, I'll stick around. I have a hard stop at 6, but I know Keith's here another hour.
Yeah,
so
I'm actually, guys. So Pat, that's why Pat is here. I have a parent meeting this evening for the Oakmont Marching Spartans because all of their equipment and all of the things that get built for their shows. That's me.
Goes through you.
And thank you. And they're, my son is a section leader for that band. This is about what do I do when I turn 65? Okay? Do I? You're laughing. you're laughing. Okay? There is so much information out there. You have to sign up for Medicare. If you don't sign up for Medicare, you're going to get penalized. You're going to get smacked, okay? Brian is going to educate you on the do's and don'ts, the good, the bad, the ugly about Medicare. Guys, Medicare is changing.
It's confusing too.
Medicare has changed so much, and there's so much change for January of 2025 with the drug plan laws, the Part D drug plan laws getting mixed and stirred and upheaved and moved and changed. And we are here simply to educate you on what you should do, what you shouldn't do, and how you do it. Now, Brian's going to handle the initial portion of the education for you. Pat's going to stick around because we don't want to, say, well, I've got this condition and I take this med and this med and this med, and here, let me show you the we're going to keep things what we call, we're going to keep things what we call HIPAA compliant, all right? Let's keep your personal stuff. If this is applicable to you, if you have more questions that you want answered, Pat's hanging around, Brian's hanging around. We are here every Thursday. You can call Nancy and book an appointment with us, or you can just arrange to have Pat come to your home and meet at a time that's convenient for you. Guys, thanks for coming. Again, food, drinks in the back. Brian, please.
All right. Thank you, Keith.
Thank you.
Thank you, Nancy, for having us here. And again, this is more of a generic presentation regarding what happens when you become Medicare eligible. So I'll talk about, there's two sections to this presentation. The first one is Medicare and Medicare-related options, and you know, the type of plans you can enroll on. Again, they're not Blue Cross plans per se, but they're plans nonetheless. And section 2, options if you're retiring before you become Medicare eligible. That's an issue as well for some people. So we're going to start with this. So we always start our presentations with this slide. This is your starting point when you become Medicare eligible. There are a couple of ways you can become Medicare eligible. Turning 65 is one of them. The other one might be if you're disabled and you're in your 25th month of disability, you become Medicare eligible. You can get Medicare Parts A and B. Everyone's heard of Part A and Part B. Part A is your hospitalization insurance. Typically you get that at no cost as long as you've had 40 quarters of Medicare tax taken out of your paycheck in your lifetime. And Part B is what you pay for. It's $174.70 per month in 2024 for most people right now. There's a threshold as far as what you can report to the IRS. If your threshold's a little bit higher, you're going to pay more for that. But right now we're going to say it's $174.70. Part B covers everything else outside of inpatient hospitalization. Again, once you have Medicare Part A and you purchase Part B, now you have the right, you have what's called original Medicare, and you have the right really to purchase a plan, a supplemental plan to replace original Medicare. So I say that everyone starts on the blue bar, the navy blue bar. That's your original starting point. When you get A and B, you're going to hear the words original Medicare a couple of times. When you get A and B, the government says, okay, we're going to give you original Medicare. Okay, that's insurance that they give you. At that point, once you realize, and I'm going to go through that in the next couple of slides, when you realize that you don't want original Medicare anymore for whatever reason, now you can choose either a Medicare supplement plan right here or a Medicare Advantage plan. Those are two different types of plans. On the left side is the Medicare supplement plan. There are two blue bars because the first one represents the health insurance plan. The bottom one represents a Medicare prescription drug plan, or what we call a PDP plan. That's your drug plan. If you choose a Medicare supplement pathway to get your insurance, then you have to also purchase a separate Medicare prescription drug plan because drugs aren't included with Medicare supplement plans. On the right side is what we call Medicare Part C, or Medicare Advantage. That is the type of plan a lot of us are used to. It works like, you know, you get co-payments and you get the prescription drug insurance benefits built in on most plans. But I know with Blue Cross, all our Medicare Advantage plans include Part D prescription drug benefits. So again, you can choose that plan or you can choose that plan there. So we're going to start with original Medicare. I told you I would talk about this. There's your red, white, and blue Medicare card there. So original Medicare is what you get from the federal government for nothing, really, as long as you have A and B. Now remember, you're still paying your Part B premium. It's health insurance provided by the federal government. I mentioned Part A pays for inpatient hospitalization care. It's premium free for most people. Part B pays for doctor services and outpatient care. It's $174.70 per person per month in 2024 for most people. And again, as I mentioned earlier, higher annual income will increase what you pay for Part B. How Medicare works, how this original Medicare plan works, you can see any provider in the country who accepts Medicare. No primary care provider is required, and no referrals are necessary for specialty care. And you pay deductibles and co-insurance. We're going to talk about that as well. So how do you enroll in this plan? If you're turning 65 and you're collecting Social Security, you should automatically receive your red, white, and blue card 3 months prior to your 65th birthday. If you don't receive it, I like to say, and Keith would probably tell you, if you don't receive it, or Pat, if you don't receive it, I would say 6 weeks before you turn 65, I would contact Social Security. Say, hey, I'm turning 65 on April 1st. I need my card. Coverage for original Medicare will start on the first of the month of your 65th birthday, unless your birthday is the first of the month. If you're the first of the month, anyone here born on the first of the month? No? Okay. So let's say you were February 1st. You would be kicked back to January 1st. So if you're the first of the month, you're going to go back a full month. I'm actually February 2nd, so I only get kicked back one day. So my effective date would be February 1. If you turn 65 and you're not collecting Social Security and you want to have your Medicare coverage, you would contact Social Security 90 days or 3 months prior to your 65th birthday. Your initial enrollment period to sign up for Medicare consists of a 7-month-long period. So initial enrollment period, or what we call IEP, consists of 7 months. It's the 3 months prior to the month of your 65th birthday. It's the month of your 65th birthday, and then it consists of the 3 months after your 65th birthday. And during that 7-month period, you can contact Social Security and let them know, hey, I'm turning 65. I want to have my A and B. Now, obviously, they can't go backwards when they enroll you, so if you call them after your birthday, they're going to put you on the following month. So you don't want that gap in coverage. If you have insurance already, it's not a problem, but if you don't have insurance and you want that insurance, you got to make sure that you call them before you turn 65. Good segue. So if you continue to work past age 65, there's no rule or law anywhere that says that you have to go on Medicare. Okay, so if you have insurance through an employer, or if you have insurance through a spouse's or a partner's employer, then you're okay. So you can be 68, you can be 70, 71, 72. You can continue to work, and as long as you have access to health insurance through that employer, okay, then you're okay. Now there's a little caveat here on the second bullet point I'll get to in a second. If you continue to work past age 65, you can contact Social Security to enroll in Part A. You can delay signing up for Part B beyond age 65 with no penalty, as long as you have group or employer insurance from an employer that has 20 or more employees for whom you or your spouse is actively working. If the employer has less than 20 employees, you would check with their HR person or their benefits administrator about the options that you might have to continue with your employer coverage after you're eligible for Medicare. It's probably something Pat and Keith might be able to help you with as well, but it's important to know, again, that if you're working for an employer that has more than 20 employees, you really have no issue. If your employer has less than 20 employees, you can just go to the HR person and find out what happens with your claims after you become Medicare eligible. Now, when you or your spouse stops working or your health insurance coverage ends, you're entitled to a special enrollment period. It's a long enrollment period, and I would not suggest that you wait ever if you lose your insurance. If you know you're losing your health insurance, you want to jump on that right away and make sure, especially after age 65. Let's say you're 68 years old, you've been working for a while, you're like, all right, I'm going to retire August 1st. If you know you're retiring, you're also going to lose your health insurance typically on that day. You want to make sure you get your ducks in a row and get A and B for that date so that there's no gap in coverage. Okay, in the bottom there's some small letters that you can't see probably. I can barely see them here. Once you're on Medicare, you can no longer contribute to a health savings account, an HSA. However, you can use the funds that are already there, because with an HSA, those funds are yours forever. You can take that with you. You can use those HSA funds to pay for medical expenses. You can also use them to pay for Medicare premiums for Part A, Part B, Part D, or Part C, which is your Medicare Advantage plans, but you can't pay for Medicare supplement or Medigap premiums with your HSA. That's important to know as well. And that's if, obviously, if you have an HSA and you're working right now and you have your insurance through your employer. Now, I'm going to talk about Original Medicare. This is not a plan offered by Blue Cross. It's not a plan offered by Tufts or anybody else. This is what the government gives you initially, okay? And a lot of people, I would say 99, I don't know if Pat agrees, but 99% of the people I talk to don't stay on Original Medicare. And you'll know why in a second. So Original Medicare works like this. It covers Part A here covers inpatient hospitalization. I told you that already. And the skilled nursing facility benefits as well. But there are big caveats here. So with inpatient hospitalization, if your inpatient hospital stay is anywhere from 1 day all the way through 60 days, you're covered, but you have to pay a $1,632 deductible. Okay, so if your inpatient stay is 5 days, you pay that. If it's 10 days, you pay that. Okay? If you stay in a hospital beyond 61 days, that's a long inpatient stay, you're going to start paying a $408 copay, or it says coinsurance, but it's really a copayment per day. If your stay lasts anywhere from 61 days to 90 days, you're going to pay that $408 every day. Now that's unusual. An inpatient stay of more than 2 months is unusual, but you should know that this exists in case it happens. Now, if your inpatient stay is beyond 90 days, say 91 days to 150, you are also going to have a coinsurance or a copayment per day starting on day 91 of $816 a day. Okay. Now, again, unusual to stay in the hospital that long, but if you do, at least you know what happens here. If your inpatient stay is more than 150 days, you have no coverage at all, and you're going to pay 100% of whatever it is that you incur. Now, the other caveat here with inpatient stays is that that deductible of $1,632 is applicable every 61 days, and I'll explain that. So let's say you go in the hospital for 7 days in February, and you leave on February 9th. If the time you leave the hospital, you're discharged, and the time you go back in for another inpatient stay is beyond 60 days, so my example was February 9th, let's say you go in on May 1st, that's beyond 60 days from the time you were discharged, you're going to pay that $1,632 again. If 61 days does not elapse, you leave on February 9th, you go back in on March 7th, for example, you're not going to pay that $1,632. But if 61 days goes past or elapses from the time you leave the hospital till the time you go back in, you're going to pay that $1,632 again. So that's always kind of hanging over your head. Now, a skilled nursing facility benefit under Original Medicare works like this. The government's always going to pay your first 20 days in a skilled nursing facility or rehab facility. If you're in there for more than 20 days, from days 21 to 100, you're going to pay a copayment, or it says coinsurance, copayment of $204 per day up to day 100. If you're in that skilled nursing facility for more than 100 days, you have no coverage at all, which means that you're on the hook to pay everything, whatever the costs are beyond day 100. Okay, so that's Original Medicare and how it works with Part A. Now, I like to say it's something. The government's giving you something, but they're having you, pay for a lot here. Now, here's Medicare Part B and how it works with Original Medicare. Now, remember, Part A was your inpatient hospitalization and your skilled nursing. Part B are your doctor's visits, everything else that you can think of, your ER visits, your lab work, your occupational, physical, or speech therapy, durable medical equipment, anything else that doesn't involve inpatient hospitalization is covered on Part B, and your responsibility is one thing, actually two things. The first thing is you're going to pay a $240 one-time deductible from the time your plan starts. So if you have anything done outside of inpatient hospitalization, let's say you go to a doctor or a specialist, you're going to pay the first $240 of that bill. Beyond that, you're going to pay 20% of everything else that you incur for the rest of the year. Medicare pays 80%. You pay 20%. What happens is if you stay on Original Medicare, the bill goes to the government, they pay their 80% after you pay your deductible, then the bill comes to you and you pay 20%. So that might be why people, Pat, right? That might be why people don't stay with Original Medicare, because you're always going to have to pay 20% of everything you incur for the rest of the year. Now, what's not covered by Original Medicare might be just as important as what is covered. Outpatient prescription drugs. So the government, Original Medicare, is never going to pay for drug benefits, so you'll have to get your own drug plan. And then care received outside the United States is not covered. Routine vision and routine hearing exams are not covered, and routine dental care is not covered. So at this point, you say to yourself, all right, I think I understand that the government gives me what's called Original Medicare. It's a plan. Okay, it's all right. I do have those deductibles. I don't know if I want that 20% the rest of my life. I think I want to go on a plan. Now, it doesn't matter, again, if you go on Blue Cross or any other plan, but you have those choices. I'm going to start with Medigap or Medicare supplement plans. Those were the plans on the left side that had two boxes. So a Medigap plan is a plan that you add to Original Medicare. That plan will pay your deductibles and your coinsurance costs for you. In 47 states in the United States, there are 10 Medigap plans that they sell. In Massachusetts, Minnesota, and Wisconsin, we can do what we want. We have 3. So every carrier that offers Medicare insurance is going to offer a Medicare Supplement Core plan. They're going to offer a Medicare Supplement 1A plan, and they're going to offer a Medicare Supplement 1 plan. We're lucky. We have 3 plans. So when you come back in the fall and we are actually here to talk about what our plan offerings are for next year, you're not going to hear me talk about 10 plans. It would take forever and it would be really confusing. You're only going to hear about 3, and that's good because trust me, you don't want to hear about 10. I think there's a slide later on that shows you those 10 plans just for, you know, for visual effect. Now, how you receive care for these plans, you would show your original Medicare, your red, white, and blue card, and you would show your, let's say, Blue Cross Blue Shield card because you joined one of those Medigap plans. Because the red, white, and blue card, the doctor is going to know to send that bill to the government, okay? Now, when that bill goes to the government, they pay their 80%. Instead of the bill going back to you, you show your Blue Cross card because now that bill is going to go from the government to Blue Cross, and we're going to pay your 20%, and we're going to pay your deductibles as well. As it says there, Medicare pays first, and then the insurer pays the balance based on how the plan works. Key points are you can still see any Medicare doctor or provider anywhere in the country that accepts Medicare. There are no referrals, and there are no co-payments on these plans. So this slide's really important. Medigap plans in Massachusetts. I told you there was a core plan, a 1A plan, and a 1 plan. The core plan is the least expensive generally. The 1A plan is middle of the road, and then the Supplement 1 plan is typically the most expensive because it covers the most. If there's a green check mark on this chart, it means that the plan pays for that particular benefit on the left side. So we start with the inpatient hospital deductible of $1,632. The core plan does not pay for that. So if you choose the core plan, because it's the least expensive plan with any carrier, you're still going to have to pay that deductible. However, the Supplement 1A plan and the Supplement 1 plan pays for that. Your inpatient hospital coinsurance or copayment of $408 or $816 covered by all 3 plans. You don't have to worry about that if you enroll. Your skilled nursing coinsurance or copayment of $204 a day from day 21 to 100, covered by the 2 plans on the right, not covered by the core plan. The deductible, Part B deductible, $240 that I told you about, it's only covered by the Supplement 1 plan all the way to the right. Every carrier calls their plan, gives their plan a name. We call our Supplement 1 plan the MedX Bronze plan. We call our Supplement 1A plan the MedX Sapphire plan, and everybody pretty much calls the core plan. We call it the MedX Core plan. Other carriers might do the same. If you choose the MedX Bronze or the Supplement 1 plan, then you're going to have that $240 deductible paid for. Part B coinsurance of 20% is covered by all 3 plans, which is why a lot of people choose a Medicare supplement plan. Again, not just with Blue Cross, but with any carrier, your 20% is going to be covered by either of those 3 plans, which is really great. Your outpatient prescription drugs are not covered at all, so you will have to sign up on another prescription drug plan. I know that Pat and Keith are really helpful with helping you find a PDP plan to sign up on if you enroll on a Medigap plan. And care received outside of the United States, typically not covered on the core plans, but covered on the Supplement 1A or Supplement 1 plans. Now there's a box all the way to the right that, I keep saying the word caveat. There's always a catch. There's always a caveat. In 2015, the government passed a law called Medicare Access and Chip Reauthorization Act, or MACRA. And what it stated was, and again, this is in 2015, 9 years ago, they said starting in 5 years, anyone that becomes Medicare eligible will not be eligible to enroll on the Supplement 1 plan, okay? Because the Supplement 1 plan pays for everything. So they gave everyone 5 years, and everyone said, oh, okay, that's great. That's 5 years from now. We don't have to worry about that. Now we're 9 years down the road, and now we're going backwards. So my job is to make sure everyone knows that if you became Medicare eligible before January 1st of 2020, then you can enroll on the Supplement 1, or what we call the Bronze plan for Blue Cross or whoever else calls their plan. But the Supplement 1 plan, you can enroll on that. If you become Medicare eligible on January 1, 2020 or beyond, you cannot enroll on the Supplement 1 plan. You're only bound to enroll or required to enroll on the Supplement 1A or the Supplement Core plan. So while it was a great rule 9 years ago because people had 5 years to worry about it, now we're 9 years down the road and we're looking back 4 years on that. This is that slide I told you about. These are the 10 plans offered across the country. I won't even begin to understand this slide because it's confusing. We only have the Core, the 1A, and the 1 plan, which I think is great. Now, Medicare prescription drug plans are what we call PDP. What is Medicare Part D? I tell people Part D, D equals drugs. Always remember that. I think actually Keith taught me that years ago. D equals drugs. It's an easy way to remember it. Prescription drug insurance offered by private insurance companies like Blue Cross, contracted with the Centers for Medicare and Medicaid Services, or CMS, that covers outpatient prescription drugs. If you choose a Medicare prescription drug plan or a PDP, you will pay monthly premiums to whatever insurer you choose. And all Medicare Part D plans are required to follow a standard outline of coverage that is outlined or determined by CMS. Now, CMS, again, is a big portion of the government that oversees or regulates health insurance. So they actually regulate what we can say and what we can present to you. They authorize everything by everybody. Now, those three standard outline of coverage levels or phases we call are initial coverage, coverage gap, and catastrophic coverage. That's for any prescription drug plan. Now, the plan designs within these levels, such as what your deductibles might be, what your co-pays or cost sharing might be, the formulary, which is the list of drugs covered by the particular drug plan that you sign up on, and what pharmacy network they use. Those particular things help determine what the monthly premium is for the plan. I do know that there is a plan this year that's 50 cents a month. Is it WellCare? I think it's 50 cents a month, but their formulary might be really small. That might be a catch, but it's a good plan. They also offer a plan that's more. Now, because it's more money, let's say, I don't know if it's $20 or $23 a month, that formulary might be a lot bigger. And they might say, okay, because you're choosing a plan that costs a lot more money, you have access to a lot more prescription drugs. We cover more drugs. So you're going to want to make sure you check out their pharmacy network, their formulary, what their deductibles are. Obviously, if you can afford it, those are going to be all factors that you're going to go over with whoever you sit down with to help you find that prescription drug plan in the future. Now, these are coverage periods. These are those three stages that the CMS wanted us to include in our prescription drug plans, and this is how they work. So the initial coverage stage, actually the deductible stage is first. Some plans don't have a deductible, and some plans do. So if you have a deductible built into your prescription drug plan, say it's $545, that's typical, then you're going to pay, usually on tiers 3, 4, and 5 prescription drugs, you might have that deductible. Let's say you do. You're going to pay that $545 towards the first $545 toward the retail cost of the drugs that you incur, tiers 3, 4, and 5. Once that's gone, or if you don't have a deductible at all, you're going to jump right into the initial coverage stage. And what that means is you're going to start paying copays. So I think we all pay copays for our drugs. You might have a $10 copay for a tier 2 drug. You might have a $1 copay for a tier 1 drug, which is a generic drug. You might have a $40 or $50 copay for your tier 3 drug, but you're paying copays or you're paying co-insurance. Usually for a tier 4 or a tier 5 drug, which are the most expensive drugs, you might have what's called co-insurance, which is a percentage. So you might have to pay 40% toward the retail cost of a tier 5 drug, which might be in the thousands. You know, some of these drugs are expensive. But when you're in the initial coverage stage, you're just paying copays. Now this is where it gets a little confusing. When the total retail cost of all the drugs that you incur or you pick up in a year, when that total retail cost reaches $5,030, you're going to stop paying copays for your drugs and you're going to go into the coverage gap stage. Does anyone remember what the coverage gap used to be called? Say it loudly. Donut hole, perfect, thank you. That's a good memory right there. The donut hole. So we call it the coverage gap now because at that point you stop paying co-payments for your drugs, and you start paying 25% toward the retail cost of your drugs. So again, the total retail cost. Now, the total retail cost might not be known by you. You just might say, okay, it's a tier 2 drug. I'm paying $30 for it for a 30-day supply. That tier 2 drug might have a $200 retail value to it. If it does, that means you're paying $30 for it, and whoever your drug plan is, let's say it's Blue Cross, pays the other $170 because that $200 is being paid for. And the government, CMS, is taking that total retail cost of $200 and they're adding it up throughout the year. So if you get that one drug every month for the whole year, it's $200 times 12, that's $2,400 that's going to apply towards that $5,030. Now that's only one drug. Let's say you take 5 prescriptions. Now the total retail cost of all your drugs, once they reach $5,030, that could be any time during the year, you're going to stop paying copays, like I said. You're going to start paying 25% toward the cost of your drugs. Now, this right here, once your out-of-pocket cost for your drugs reaches $8,000, then you stop paying 25% for the cost of your drugs, and you go into what's called the catastrophic coverage stage, and now there's no cost to you for your drugs. You pay nothing. I know, right? He's laughing because it's whimsical. It's just, I've been doing this for years and years. It used to be worse. They used to make you pay percentages. Now they don't let you pay anything. But the easy thing to remember, I guess, if there is an easy thing to remember, is the gap, or the hole, the donut hole, as they used to say. The gap is $5,030 to $8,000. So once again, total retail cost of your drugs reach $5,030. Up to that point, you pay copays. Once you hit $5,030, you pay 25% for your drugs. Once your out-of-pocket costs reach $8,000, now you pay nothing for your drugs for the rest of the year. The bad news is you've paid $8,000 out of your pocket. The good news is you don't pay a penny the rest of the year. So I know from experience that my mom hit the donut hole or the coverage gap early in the year, and she definitely paid $8,000. So I think for 5 months out of the year, she didn't pay anything. But there's a good side, there's a bad side. But that's how the Part D, works. That's it about the Medicare supplement plan. We're back to this slide. I won't go through this slide again, but I am here to tell you that we covered this. Now we have Medicare Advantage plans. So you may have said to yourself a while ago, geez, I don't know if I want that 20% with original Medicare. Brian already told us about Medicare supplement. Okay, I think I get it. Now let's learn about Medicare Advantage. And these plans are a little easier to talk about. Now I start with this slide because there are Medicare Advantage plans that carriers in Massachusetts, including Blue Cross, charge you nothing for. So we call them $0 plans. Some carriers have them, some don't. I know that we have a few. And people always say to me, geez, this plan looks awesome, but how can you afford to charge me nothing for a plan and still pay my claims, still be in business, pay for all my drugs, pay for everything, offer me vision, dental, whatever it is you offer me, and how can you still make money? How can you? Well, this slide will illustrate how that is. We believe in transparency when we educate. So I'm going to let you know that Medicare is the government. That green arrow goes down to private insurance organization. That could be any company. Let's say it's Blue Cross. First bullet point, Medicare pays the private insurance organization or the plan to provide your Medicare benefits. We get money from the government for everyone that signs up on our Medicare Advantage plans. We get money. So it's not a lot of money, but it's something. So we are able to take that money, here's that first green arrow, to pay your doctors, pay your hospitals, pay other providers, and we also put some of that money into research and development, and we also, so that we can offer you dental benefits, vision benefits, hearing benefits, and we throw some of that money to doctors and say, we want you to come into our network as a dentist or an optometrist or a hearing doctor. So we offer you additional benefits that you might not get with the Medicare supplement plans. And finally, the last green arrow there, you pay premiums, that's your responsibility, and you pay cost sharing, which means you have co-payments to pay when you use the plan, and you're going to follow rules that come with the plan. Now, when you receive care and you're on a Medicare Advantage plan, that red, white, and blue card goes away because the government doesn't pay anymore. We kind of tell the government, if you're going to join a Medicare Advantage plan, your plan is going to tell the government, okay, kind of leave the room. We're going to take care of Sally Jones here. She's on our plan, so you're going to show them your card of the plan that you enroll on. That doctor is going to send the bill not to the government. It's going to come straight to the plan that you enroll on, whether it's Blue Cross or somebody else. When you receive care, as it says there, you're going to show your ID card only, not your original Medicare card. The final or the bottom bullet point is important. In order to stay enrolled on these plans, you must continue to pay your Part B premium. So you have to pay that $174.70 or whatever it is every month in order to stay on any plan, whether it's Medicare Supplement or Medicare Advantage. So a Medicare Advantage plan provides all benefits that you get with original Medicare, in addition to extra benefits such as vision, hearing, and dental, and could include prescription drugs. I can tell you that all 5 of Blue Cross's Medicare Advantage plans do include prescription drugs. As a member, you would pay co-payments and or co-insurance when services are rendered. Now remember, with the Medicare supplement plans, there were no co-pays, okay? This plan has co-pays, so they work in different ways. We have Medicare Advantage HMO plans, and we have Medicare Advantage PPO plans. When I say we, I'm probably speaking for all the carriers across the state. On a Medicare HMO plan, you would designate a primary care provider or a PCP to be the gatekeeper of your care, okay? And you're going to have referrals, and you're going to use in-network providers for most of your care, and you're going to pay co-payments. If you choose a Medicare PPO plan, they kind of let you go out of network for certain services, but you're going to pay a little bit more for that. You're going to designate a physician of choice, a POC. You can use either in-network or out-of-network providers, and again, you're going to pay a little bit more if you go out-of-network for your care. You're going to pay co-payments and or co-insurance as well. Now here is a chart that shows you exactly when you can enroll on these plans. I told you about initial eligibility a while ago, what we called the IEP, or initial eligibility period, being 3 months before your 65th birthday, the month of your birthday, and up to 3 months after. Or Medicare due to disability, it would be 3 months before to 3 months after the 25th month of your disability. That rule applies to Medicare Supplement or Medigap plans, Medicare Advantage plans, and Medicare Part D or prescription drug plans. There is an annual election period. Pat knows that that is when the rubber hits the road and we stop seeing our families, right? We're on the road 23 hours a day. We're in hotels, we're at senior centers, we are all over the place, libraries, letting people know that from October 15th to December 7th, that 9-week period is when you can enroll on a plan. Okay, that's when you come to Pat or Keith or myself or anybody and say, okay, I want to sign up. That's when you do it, and you're going to have a January 1 effective date. That applies to Medicare Advantage plans, and it applies to Medicare Part D prescription drug plans. There's a Medicare Advantage, what we call open enrollment period. That's fairly new, I want to say the last few years, where the first 90 days of any given year, from January 1 to March 31st, you have a 90-day, almost a trial period, where if you're enrolled on a Medicare Advantage plan and you don't like your plan, for whatever reason, or if you just want to change your plan, you can do that. You have until March 31st to switch from one Medicare Advantage plan to another Medicare Advantage plan, or to disenroll from your Medicare Advantage plan and go on original Medicare. I'm not sure a lot of people do that, but people will switch from Medicare Advantage to Medicare Advantage, and it doesn't have to be with the same carrier. If you didn't like the carrier that you initially signed up with the first 90 days of the year, you can switch to another carrier. That's totally up to you. And there might be special open enrollment periods that apply to you, such as you may have lost your health insurance through your employer. Like I said earlier, you're definitely going to want to make sure that you do something so there's no gap in coverage there. You may have moved out of or into a service area where there is a health insurance plan that would give you the right to enroll on that plan. That applies to all the plans there. So those are your timelines as to when you can do that. This here is interesting. I told you earlier that when you have a Part B at $174.70 per month, that if your income is higher than a certain number, you're going to pay more for it. This slide illustrates what that is. Your modified adjusted gross income, if it's more than $103,000 and you file your taxes individually, you're going to pay more for your Part B, and you're actually going to have a little premium tacked onto your Part D or your prescription drug premium as well, monthly. So individuals with a modified adjusted gross income of $103,001 up to $129,000, you can see that it's actually just about $70 more a month for Part B. And you're going to have almost $13 tacked on to your Part D prescription drug monthly premium as well. If you're a married couple and your modified adjusted gross income is more than $206,000 up to $258,000, same thing. And then you can see that the levels go up. If you're David Ortiz and you make more money than anybody even knows about, you're going to pay $594 for your Part B premium. Can you imagine that? And then he's going to also have $81 tacked onto his prescription drug plan. So I guess he can afford it. So I don't feel sorry for him. Some helpful resources here. I talked about CMS, the Centers for Medicare and Medicaid Services. 1-800-MEDICARE, really easy to remember. That's the government. Their website's awesome as well, medicare.gov. Social Security, their website has really improved in the past 10 years. I love it. It's ssa.gov. Check it out. It's helpful. The state health insurance assistance programs is SHIP, SHIP, center.org. Everyone's heard about Shine Counselors. Their 800 number is right there, 1-800-AGE-INFO. Mass Medline is a pharmacy outreach program in Massachusetts. There's no cost to you to talk to a pharmacist or a case manager. Really great resource if you have just been put onto a new prescription drug and you're worried about conflicting or side effects, or maybe the drugs how they interact. Really great phone number to call to talk to somebody about that. Prescription Advantage is a Massachusetts-sponsored prescription assistance program that helps you pay for your drugs while you're in the coverage gap and outside of the coverage gap. You have to call them to see if you qualify. Their qualification process is actually a little more lax than, say, if you were going to try to get federal aid, because they don't take assets into consideration with Prescription Advantage. So it's definitely worth looking into. And I would be remiss if I didn't mention Blue Cross. BlueCrossMA.com/Medicare is a website that you might want to go to if you want to learn about our plans. Now, Section 2, we're done with talking about Medicare supplement plans and Medicare Advantage plans. Now I'm going to talk real quick. This is not a long, maybe 3 slides here, about what to do if you're retiring before you turn age 65 or before you become Medicare eligible. So you have 3 options. When you retire younger than age 65, when you need, or if you need coverage for family members who are still on your plan, and then they're not yet age 65. You have a spouse or partner's plan, you have COBRA, or you have direct pay. Some considerations to think about are getting a plan with access to your current provider or providers that you might desire. You want to choose a benefit design on the particular plan that fits your needs. And actually, the number one by far consideration that you want to think about is cost. Why buy the Mercedes when you can only afford the Honda? They're still going to get you to the same place, right? Maybe you won't look as good, but it's okay. It's a Honda. It's going to get you there. It's a great car. Now, the same thing with health insurance plans. I always tell people, try not to buy more than what you can afford. You know what you can afford. If your plan's going to work for you, there's always a plan that's affordable. Like I mentioned, those $0 plans earlier. If you can't afford anything besides that, that's totally fine. So cost by far is a consideration you want to think about when you're choosing a health insurance plan. Now, the first square, as we go back, was your spouse or partner's plan. You might want to consider that if it's an employer-sponsored plan. Coverage would be whatever plan design they choose. Eligibility would be whatever rules they have. Premium would be set by the plan or by the employer, and they would have payroll deduction most likely. We talked about COBRA. I think everyone knows COBRA is a temporary continuation of your employer group coverage. It can be up to 18 months. For spouses or dependent children, it can be up to 36 months, depending on what the situation is. Qualifying event for COBRA would be termination of employment. Therefore, they're terminating the health insurance plan you're on, divorce or legal separation, or even death, you would verify the qualifying event with that employer to make sure that you are eligible for COBRA. Now, COBRA premium is going to be 100% or even 102%. You're nodding because you've been there, right? It could be 102% of what the cost of the plan is. They can always add that 2% for administrative costs. So you get that letter and you say, ooh, geez, really? Is that what's going to cost me? Uh-oh. Which leads us to the third option, which might be a little more affordable or a lot more affordable, is a direct pay plan. Here in Massachusetts, we have the Massachusetts Health Connector at mahealthconnector.org. Their 800 number is there. That's a direct pay plan. They've really improved over the years. When they first came out, it was a little bit sketchy for a lot of different reasons. Now they're awesome. They've got some awesome carriers, some really great plans at affordable prices. It's worth checking into to see if they have a plan that works for you, because if COBRA's not an option or a viable option, and if you don't have access to a employer group plan and you're not yet 65, this might be your only option, a direct pay plan. The good thing about direct pay plans is it may include individual but two-person and family health insurance. It can be purchased directly for the insurer, and the premiums are billed directly to you rather than through your employer if you had one or whatever. So that is direct pay plans, and that's it for my presentation. I know it was a lot of information. I'm sorry you had to listen to me for this long. My wife would be very proud of you. And I thank you very much for listening and hope that you learned something. I'm an educator. We go out there, I'm on a team of 9 people, and what we do is we go all over the state educating people just like this. We've got all kinds of topics. Another topic is what's the difference between a Medicare Advantage plan and Medicare Supplement. We do webinars, but my mantra is the same. If you can walk out that door knowing a little bit more than when you walked in, I did my job. So hopefully that happened today. Thank you very much. I appreciate it.